Good morning, everyone, and welcome to episode 6 of Add Water and Stir. Cheers. So today's topic, like we said, is going to be direct-to-consumer marketing. I think that's something that's really important to get in place as we are about to start a new year and hit the ground running with our practices, including our dental sleep medicine practices. So we'll talk a little bit about some things that you can do direct to consumers, so new patients that you've never seen off the street, butts and chairs, and then also some things that you can do internally to start the conversation with your patients of record or potentially get some referrals from your patients of record. How does that sound?
Sounds good to me.
Awesome. So let's begin with our easiest direct-to-consumer marketing campaign. Depending on where you live, there should be a local newspaper. At the checkout line, at the market, tossed up on the driveway once a week. It is going to be specifically for your area and surrounding areas, so targeting geographically desirable patients. And ad space is relatively easy to get. Unfortunately, printed press is a dying art, so you might be able to get yourself a little deal. And placing a really simple ad, like the one I am about to hold up,
Make it closer.
is a great way to bring in some new patients. Now you'll see there's some things on this ad, let me put my coffee down, that we really recommend for all direct-to-consumer marketing campaigns. A really clear, concise message. Now this one is going to do double work for us this morning because it is not only a Hate Your CPAP ad, it's also for an informative seminar. But you'll see the three main elements that we recommend for an ad for dental sleep medicine. Hate your CPAP. We're making it personal. We really want to get that visceral gut reaction, seeing the guy in the CPAP and thinking, wow, that's me, or that's supposed to be me, or that's someone I love, and he must be miserable, or he is miserable. And then, of course, our tracking number. Now we had a vanity number for a little bit, which was a lot of fun, but we have since switched it to a regular tracking number. And your phone will ring. People know what CPAP is. It is very widely prescribed and very widely disliked.
What about some other ways to get that message out that could work besides a newspaper?
Well, there is also email. If you have a constant contact or smile reminders, adding it to your email blasts that are going out. You can get this message out by asking patients questions.
Also billboards.
Again, depending on where you live, there might be billboards on local roads. Ideally not where patients are going 80 on a freeway. And again, same message. Hate your CPAP, picture of a guy in a CPAP, tracking number. So you might need to go on a little field trip around town and take a look at the billboards in your area, or if you're allowed to put signage in front or around your office, that's always a good idea. If the billboard says McDonald's on it, move along. They have a monopoly on that.
What is the demographic of the people who are reading newspapers? Because I know a lot of you might be feeling, newspapers, that's so 20th century. But who is reading the newspaper?
Our target audience.
Yes.
Middle-aged people that have been diagnosed with obstructive sleep apnea, that are supposed to be using CPAPs, that might have a little more freedom to travel and not want to schlep that thing around with them.
There you go.
That are interested in preserving their health and continuing to have happy, healthy lives. And that, again, are reading newspapers and clipping out the coupons.
Okay.
Okay.
What else can we do?
So let's move on to some things that we can do to attract patients that are all already in our practice.
But wait a second.
Uh-oh.
So somebody sees my ad in our local Acorn newspaper, and they are interested in what we do, but they think that, wow, this is too good to be true. There's an alternative to CPAP. So the phone rings, and then what?
Oh, well, then we have to be ready to answer the phone. Having a phone script in place, collecting all the information that we need in order to get that patient into our practice. That includes insurance cards, sleep studies,
But what
getting
are some
to
of
the
the
bottom
talking
of the
points?
why. Why is this patient reaching out? Some of the talking points would be if they have been prescribed a CPAP, how long are they using it? How long have they not been using it? What health reasons have come up? And what an alternative would do for their life, how that would improve their lifestyle, their overall health, seeking treatment for a sleep apnea.
So let's do a little role play, okay? All right. So
Exciting.
So here's how my office personnel are trained. Well, what's the number one most important aspect of phone etiquette? Number one, answer it. Okay. You must have people answering your phone during business hours, 5 days a week, a live person that is representing you. Because if it goes to voicemail, that person on the other end might just go next.
And
Choose
especially
the
for
next one.
something that's a little tricky like this, it's not just like they're calling to get a hygiene appointment.
Right.
It's this kind of off the cuff gut reaction, making that call while those emotions are still high.
Right. So the phone rings, and the question is, what is it? So ask me, what is it?
Well, okay. You advertised, hey, your CPAP, I'm supposed to be wearing one, I don't. What are you offering me?
Well, the dental device is like wearing retainers.
Okay.
Okay, you're familiar with retainers.
I did that.
Okay, well, the difference between regular retainers and this is that the retainer for sleep apnea is going to gently hold your jaw a little bit forward. So what I'd like you to do is right now just jut your jaw out a little bit and take a breath, and you should feel more air coming through than normal. Okay? You do. Okay? Everybody can try that. Okay. These are FDA approved. Okay?
Mm-hmm.
They're non-invasive.
Mm-hmm.
There's no drugs. There's no surgery. And they will reduce loud snoring in 90% of the people who get them.
Wow.
Yeah. Mm-hmm.
Okay. Well, what would my next step be? How would I get one? My insurance covers my CPAP.
Well, Dr. Greenman offers no-charge consultations, and we'd love to have you come in. He'll evaluate you and determine your suitability for the appliance, for the device. What I'd like you to do with your insurance is bring that information with you, and we'll take care of it when you're here in the office.
Okay.
Now, an alternative might be, do you have access to a scanner or a fax machine?
I can do that from work.
Okay, well then, if you would, we can check out your insurance in advance of your appointment if you'd like.
Even better.
Okay, so what we'd like you to do is send us a copy, a facsimile of your front of your driver's license and the front and the back of your insurance card. Also, I want to direct you to our website, or I can email you a link to online forms that we would like you to complete before your visit.
Wow, okay.
Okay. Now, have you had a sleep study?
Yes.
Okay, you said that's right. You told me that you had a CPAP, Nicole. So, okay, well that's perfect. Did you go and actually see a sleep doctor, or was it your primary care doctor?
No, I slept in a lab. Well, my primary care doctor told me I had to get tested, and I slept in a lab.
Okay, and did you ever meet any of the doctors associated with the lab?
When I checked in.
You did, okay, but did you have a consultation after?
No.
Okay, so if it's okay with you, we'll contact your primary care doctor and we'll obtain copies of your sleep studies in advance of your appointment.
Okay.
Okay, so we've got 2 appointments available One at the end of the week on Friday at 1:30, or the following week on Tuesday at 11, which works better for you?
Let's do Friday, and then I can have a half day.
Okay, all right. So that's kind of how it goes. You want to, there should be no barriers to getting these people into the practice. Make sure that there's no confusion with your team. Rehearse this. We rehearse it in my practice because we want 95% of the people who call to actually come into the office, because we know that when they meet us and they find out what we're capable of doing for them, that the answer is yes, at least 3/4, if not 80% of the time. Go ahead.
Awesome.
So now let's talk about people who already are our patients.
Let's talk about people that are already our patients. And it's probably something that we bring up in every episode, but asking your existing patient-based questions about sleep is so important. Because if not them, it might spark an idea of someone in their family or someone close to them that would need your services. So looking your patient in the eye and asking questions like, have you ever been prescribed a CPAP, or do you know anyone that has, and are you or are they currently using it?
That's a great question, and I got to tell you that you should be asking all of your patients this question.
Yes.
It should just be, there's always time for some chit chat, and so the verbiage would be, I don't know if you know that Dr. Greenman has a special part of his practice where he treats people with sleep apnea with an alternative to CPAP. I think you've heard about sleep apnea. I mean, it's certainly common. We know how disturbing snoring is. So if it's okay, I just wanted to ask you, have you ever been prescribed a CPAP, or do you know anybody? Okay, yeah. And then you just wait for the response. The reason you have to ask your existing patients, and I'll tell you a little brief story. Several years ago, I was doing a training at a local teaching institute, private teaching institute, called Aesthetic Professionals here in Southern California. We were doing a seminar, I think it was like a two-weekend seminar on sleep apnea. One of the doctors that was there went through the whole program. He even purchased a home sleep apnea testing device. We consulted with him in his office to help train up the entire team, and a couple months later, he's still in his training, but a couple months after the seminar, I get a new patient in the practice. Who's your dentist? It's him. The new patient's in the practice for a CPAP alternative, for an oral appliance. Okay, well, they weren't asking, so the patient didn't know. It would be, how would you feel if one of your patients comes back, in 6 months, and they've got a whole new set of beautiful veneers that you could have done? Well, they didn't know you did it. They didn't know you were a cosmetic dentist. So you got to make sure that you and your team, especially your team, has to be talking to people every day about what you do.
And face to face, I know I did mention if you do email newsletters and blogs for your website, that's great, get the content out there, but we're so inundated. How many times have you deleted an email that probably had information you would have been interested in just because you had to get to the ones that you needed to get to that day? So looking your patient that knows and trusts you in the eye and asking these questions is so important, even if you are spreading the word through other digital mediums.
Very, very good.
Yes.
Okay.
And then our last part, I know, again, social interaction is on the low, but maybe some things that we can look forward to planning for 2021, or if you have an opportunity to be a part of a web seminar or presentation in your area, is health fairs. It'll come back. They are usually outside, so that's good news. As maybe the weather gets a little warmer again and things slow down, they might be back. Rotary Club fairs, that sort of thing. Become a presence. Become a presence in the community, and also as a dental practice, do it as a CPAP alternative. You know, put out the signs that say, hate your CPAP. Make little buttons that say, you know, do you hate your CPAP? Ask me about alternatives, and walk around. Shake hands, meet people. That's going to set you apart from maybe some of the other dental practices that are there that are talking about, you know, the less attractive things maybe for patients walking around, you know, 3 people talking about veneers, but you're sticking to your main line. Do you hit your CPAP? Let us help you. And when they ask, oh, well, what kind of doctor are you? Well, you know, we are a dentist. We do all those other things as well. And you might not only gain a new sleep apnea patient, but a new dental patient. How often does that happen for you? Because I know you do a lot of public events, or you at least used to.
Well, I would say that a good 1 in 10 patients who come in specifically for CPAP alternative for oral appliance do become our dental patients. Why? Well, we ask them if they, you know, how they're doing with their dentist, and letting them know that we're a full service practice as well, and that we'd love to have them and their family and friends become our patients, because we are accepting new dental patients.
Yeah. So one other thing before we let you all get on with your day, this particular ad that I was holding up, I'll put a little closer, is for an informational seminar. Let you see that one more time. This particular one was held in the practice, face-to-face. Again, maybe not possible, but we can always shift gears. I think everyone at this point is a Zoom expert. It is a free platform to use, so maybe consider putting together a Zoom informational seminar. You would advertise the same way, local newspaper, RSVP today with a tracking number so that you get the call. Then you can share the email link to the seminar with your potential
Sure.
attendee, and put it on. And you know, something that we help our clients with at DSM Solutions is putting on these types of seminars, setting you up with the PowerPoint, getting you ready for the frequently asked questions, having team members present, really putting together a nice informational 30-minute maximum presentation that is going to be filled with people that are interested.
Yes.
When you advertise hate your CPAP, I always joke it's not the low-hanging fruit, it's the fruit that's already fallen onto the ground. All you have to do is walk around and pick it up. They know that they need treatment. They know how good they can feel with treatment. They just haven't been able to tolerate the treatment that they've been prescribed. So swoop on in there and grab them.
Okay, Nicole.
Yeah.
Well, let's tell people how they can get a hold of us, and then let's talk about, are we going to do another seminar?
Yes, we have to do one for the new year, 2021.
Okay.
So first and foremost, how you get in touch with us via website, dentalsleepapneatraining.com, via email, info@dentalsleepapneatraining.com. You can find us on Instagram at DSM Solutions CA. You can find us on Facebook at DSM Solutions, or you can give us a good old-fashioned phone call, 818-561-6715. So, for January, I think that our topic should be navigating reset deductibles. What do you think?
Okay, well, yeah, that explain that a little bit more.
So, new year, we bill medical for this procedure. Deductibles get reset. A lot of people now do have high deductibles because of having to buy insurance themselves from all the changes, and that might be a hindrance for some people, knowing absolutely that there's going to be no insurance coverage for them, but that is not an abandon all hope ye who enter here situation. It's very easily sorted out, and we will tell you how.
Very good. That sounds like a good one. Okay.
Awesome. Well, until next month, everyone, have a great day.